Welcome to MedTeach. Today, let's discuss about the anatomy of tympanic membrane. The tympanic membrane is located at the end of the external auditory canal, separating it from the middle ear. Tympanic membrane is also known as the window of the middle ear. It is pearly white or gray in color. It makes an angle of 55 degrees with the horizontal. Tympanic membrane is derived from all three germ layers, and the structure of tympanic membrane is said to consist of three important layers, namely the outer epithelial layer, the middle fibrous layer, and inner mucosal layer. The tympanic membrane is concave and has a distinctive cone of light reflection. What are the functions of tympanic membrane? There are two main functions, which include sound transmission and middle ear protection. The tympanic membrane vibrates in response to sound waves, transmitting these vibrations to the ossicles in the middle ear. And the tympanic membrane helps to protect the middle ear from external trauma, infections, and loud noises. What is the clinical significance? Examination of tympanic membrane is crucial in diagnosing ear conditions such as otitis media, perforated tympanic membrane, and cholesteatoma. And this is done through otoscopy. Tympanic membrane perforation can result from trauma, infection, or eustachian tube dysfunction, leading to hearing loss and potential complications. And also, a reconstruction procedure, which is nothing but tympanoplasty, is done to repair or replace the tympanic membrane, and it is often performed to treat chronic otitis media or perforated tympanic membrane. Let's discuss about some of the important landmarks of tympanic membrane also. The umbo is the central part of the tympanic membrane corresponding to the tip of the malleolus. Cone of light emerges from the umbo, and it is due to either the obliquity of the tympanic membrane or the reflection of the handle. Then we have the malleolar folds. The malleolar folds are two small folds in the tympanic membrane, anterior and posterior to the umbo. Pars flaccida is the smaller and more fragile part of the tympanic membrane that is located superiorly. We also have the pars tensa, which is going to make the lower two-thirds of the tympanic membrane. But pars flaccida, which is going to form the upper one-third of the tympanic membrane, is the most common site of retraction pockets formation. What are the other common conditions that are associated with tympanic membrane? Otitis media. Inflammation of the middle ear, often caused by bacterial or viral infections. There can be perforation, a hole or tear in the tympanic membrane, which can lead to hearing loss and complications. Tympanosclerosis, a condition characterized by scarring and calcification of the tympanic membrane and middle ear. These points should help you understand the tympanic membrane and its significance in clinical practice. Thank you for watching. Stay tuned with MedTeach.